The European healthcare market is expected to exceed €189 billion by 2024, with a number of key industry players operating in the global arena. Over the years, the European healthcare industry has demonstrated its significance in contributing to sustainable healthcare systems, progressive economic development, and increased European competitiveness on a global scale, with leading European healthcare companies such as China, Bayer, and B. Braun present here in Malaysia. Innovation through digitalization, as well as its collaborative partnerships, will pave the way for both nations to succeed.
During the COVID-19 pandemic, the industry swiftly responded to the challenges by ensuring that the right technologies are available to effectively diagnose, treat, and support coronavirus patients. Medical technologies are a crucial and integral part of the healthcare systems. They save lives, protect and improve the health of patients.
COVID-19 has triggered profound behavior changes and adoption of innovative solutions that would reshape patients' journey. Social distancing and limited capacity in hospitals had led to a surge in demands of telemedicine, in which patients consult medical professionals remotely.
Boost of the healthcare industry in ASEAN. Definitely Malaysia is playing an important role on this point, and it's got a fantastic healthcare infrastructure.
Malaysia has developed world-class healthcare services and has shown great potential in medical tourism.
The Malaysian healthcare industry is expected to grow to 127 billion ringgit Malaysia by 2027, fueled by increasing demand for healthcare services from an aging population, rising affluence, and increasing life expectancy. Recognizing the economic multiplier effect of the medical sector, the government has encouraged investment in high potential growth areas, namely medical tourism, manufacturing of medical devices, pharmaceutical and clinical research.
As Malaysia healthcare navigates the ongoing pandemic, public-private partnerships become increasingly crucial to prepare for a healthy industry rebound in 2021 and establishing a healthcare journey experience which exemplifies patient safety. That being said, as Malaysia healthcare moves forward towards our goal to become the leading global healthcare destination, we look forward to collaborations from partners in Europe to help us realize this goal.
We have contributed together with our local partners to improve the country's healthcare in terms of patient safety, providing high-end equipment and also sharing our knowledge in infection prevention and control with the healthcare authorities, hospitals, and local associations. But China does not only provide equipment in infection prevention, but also carries out educational programs through the China International Education Center, or MEC, conducted by experts and clinical specialists, which is the added value that they help to differentiate us in this competitive market.
Europe, as a leading manufacturing of medical devices, can contribute by transferring know-how or even by bringing startups in that particular space, or even in the digital transformation space, whereby we could bring technologies to support the digitalization of specific ecosystems.
B. Braun, a German company, is a pioneering medical device and pharmaceutical company in Malaysia. We provide medical devices and infusion solutions for global markets and have positioned Malaysia as a leading international medical device hub.
Innovative companies like Bayer share the common goal with the government and multi-stakeholders in ensuring patients have access to good quality healthcare and improving patients' treatment outcomes. Our pharma division has prescription drugs for niche therapeutic areas to address unmet needs and gaps that still exist with the current ways of managing diseases such as cardiology, women's healthcare, oncology, and ophthalmology.
With the increased patient volume into Malaysia over the past decade from all over the world, Malaysia's medical experts have dealt with a considerable case mix and foresee this only growing larger. Continuous knowledge exchange is quintessential to maintain high standards in service quality and enhancing the knowledge and capacity of our medical personnel.
That has been a trend since last year years in Europe, but it will be relatively new in Malaysia and many Asian countries. This important task is carried out in the sterilization departments of the hospitals, so-called reprocessing units of medical devices, or RUMED or CSSD, playing a relevant role to reduce the hospital-acquired infections, which is a very important matter. For example, in case that they need to upgrade or modernize their sterilization facilities, by outsourcing the service, they do not need to budget any upfront capital. European companies, their knowledge can also help Malaysia to achieve their goals concerning the reduction of the pollutant emissions to fight the climate change.
One of the most important things is to boost the medical device manufacturing in Malaysia due to the fact that it's important to reduce the dependency with US, China or Europe.
B. Brown's Center of Excellence for Intravenous Access is located in Malaysia. It is the only center of excellence outside of Europe with full R&D capabilities.
Malaysia is the world's largest producer and the leading exporter of rubber gloves, contributing 60% of the global supply. The government has further announced enhanced incentives recently, such as the offtake agreement and a preferential tax rate of 0 to 10% for 10 years to further attract investments in Malaysia, particularly in the pharmaceutical industry in view of the pandemic.
Malaysia is an attractive destination for the halal healthcare industry, including medical devices, medical tourism and medical products such as halal medical consumables and halal pharmaceuticals.
We expect consumer attitudes and behavior to significantly shift as a result of the pandemic, and the role of self-care will be a huge part of the new normal. Other key trends include the digitalization of patient-facing via telemedicine and teleconsult.
As Malaysia continues to maintain our position as the preferred destination for healthcare, our partners will play a very important role in reaching out to our healthcare travellers and keeping Malaysia as their top-of-mind healthcare destination.
BCN is working on a solution to digitalize the infected waste management ecosystem by connecting hospitals, logistics companies, treatment companies, as well as the landfill, basically to reduce dumping to the landfills, but also the most important is to reduce costs, especially at this moment in time where the infected waste volume is huge due to the amount of consumables related to COVID-19.
We as an industry would like to collaborate closer with payers and governments to find smart ways to improve access and adoption of innovative medicines and technologies, whether through specific support programs or smarter tender pricing models. We at Bayer are consistently reaching out and looking at new ways to collaborate and to achieve the best outcome for Malaysian patients' access and the society.
Malaysia is positioning itself to become a digital healthcare-driven country, whereby private healthcare providers will be able to access big data, cloud technology, and share services facilities.
To further strengthen the competitiveness of Malaysian healthcare sector internationally, MITI and Matrade will collaborate with International Trade Centre for the trade-related technical assistance program under the enhanced ASEAN Regional Integration Support by the EU.
Moving forward, Malaysia is kicking up the gear towards positioning ourselves as the fertility and cardiology hub of Asia, Cancer Centre of Excellence, and establishing our first flagship medical tourism hospital. Concurrently, we are exploring digitalization of healthcare and preparing our medical institutions to serve the silver tsunami as we keep ourselves ready and adaptable for the socio-economic changes of the future.
Healthcare industry is in a constant development mode to provide better tools to the healthcare professionals and governments to improve the life of people. And European companies have always been at the forefront leading the industry. Therefore, we foresee a bright future of cooperation in Malaysia if we work together with the country healthcare stakeholders.
The global health crisis has taught us how important a well-functioning public and private healthcare system is. When the pandemic struck, nations scrambled to expand their supply chains in pharmaceuticals and medical devices. The European Union, via COVAX and other programs, are setting a tone to support countries even beyond the EU member states in the fight against COVID-19. With Malaysia's strength in rubber gloves and related medical products, there are many synergies to be materialized. With each passing day, the need for a highly innovative and digitalized healthcare sector, as well as manufacturers capable of complex R&D, are at an all-time high. And this will open doors for European companies to engage and do business in Malaysia and even the ASEAN region. In light of this, it is essential for the recovery of Malaysia and even the global economy to work together, strengthen R&D networks, collaborate to address current and future challenges for public health. Together, we are stronger.
European companies have always been at the forefront leading the industry. Therefore, we foresee a bright future of cooperation in Malaysia if we work together with the country healthcare stakeholders. EU MY Stronger Together.
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 EU MY Stronger Together.